Okay.
Thank you. All right, so I'll call the meeting to order. And our first agenda item is approval of the July 20th Zoom video as minutes. Can I get a motion to approve?
So moved.
Second,
All in favor?
aye.
Abstentions? Opposed? Okay, motion carries. All right, so our first agenda item is the departmental updates from Dr. Motti.
Hello, everyone. It's so good to see everybody's faces. The sun is shining. I was gonna say the birds are singing, but I didn't hear them, so that would be a lie, but I assume they are. I am very excited to talk to you about this month's departmental update. And I will be very transparent in saying I'm sneaking in a presentation as part of the departmental updates because I do think it's imperative that we discuss the sudden and unfortunate closing of South City Hospital as a board, and I'd like to do so in a timely fashion, so I didn't want to wait till next month. So I apologize to my chair that it's technically part of the monthly report because it's in there, but I'm gonna segue after I do a few slides to just add some additional slides to provide context. So it's been hot outside. So you've seen a lot of messaging. We're talking about heat waves. Obviously, it's the first week of school for a lot of schools. Next week, St. Louis Public Schools open. So that's been a big part of our education. You know, you should know that vaccinations for children are significantly down. We can all probably understand that this is also downstream sequela from anti-vaccination sentiment during the COVID-19 pandemic. So public health will be dealing with that for quite some time to come. I had a meeting with all of the directors in the state, and all counties are seeing this and have made really impressive pushes to educate caregivers and parents, but that's tough. So when we talk about high impact items, you're going to see a few things. I'm going to be speaking in a minute about the sudden and unfortunate closure of South City hospitals. This is a health safety net. As always, it impacts the most vulnerable communities. And on my watch, we will talk about it openly, and we will not continue to let things happen without a clear strategy and understanding of what this does to community. As I said, really high temperatures, a lot of danger. You know, we spend a lot of time in the winter talking about how the cold affects especially the homeless. I don't think we think a lot about the heat and the very significant health impacts there. So we've worked a lot on that. I just want to shout out my incredible personnel liaison, Michelle Turner, 28 years in the department, in a capacity as an executive assistant, has been in this role for a year. And because of her, I get a lot of credit for breaking records in recruitment, but she is super active, partnering with Slate, working with all the managers, helping to onboard people. We have our first receptionist, look at God. We have 2 additional animal care and control officers. We have just been growing, and I just have to talk about how incredible she is. So a little picture for you there. And your girl is outside. I'm back. I'm teaching, I'm speaking, I'm talking to the kids, I'm in the community. So, you know, this Zoom speaking life I was tired of. It's wonderful to be back in person, touching people, reaching people, looking them in their eyes. So a little bit there. But really the bulk of this conversation will be about South City's hospital. I've got a 10-minute slide deck that I'm going to quickly cut to now. The rest of the report you will get tomorrow. Please disseminate it. I'm going to be talking to one of my mentors, partner, friend, Dr. Alvin Gang is going to be helping us with MailChimp to really increase the reach of this monthly report. This was mostly a pilot and something that I implemented. As you all know, it goes to about 100 trusted partners, but I'd like to make sure we're really getting it in the hands of community and increasing health literacy now that it's a vested part of what we do. So with that, I'm just going to switch slide decks. Okay, so I believe history and context is important. We sometimes think of institutions and how they impact community as static, but I think understanding the history of an institution is really critical in understanding its impact. I want to thank Craig Schmidt, who really has so many roles here, but I kind of think of him as my resident historian. You know, I'm only 2 years into this position, and I was a doctor in clinics, in a hospital. I didn't know a lot about these. So I always reach out to Craig when something significant happens, and it's him who provided me with this history. So thank you to Craig. South City Hospital originally was Alexian Brothers Hospital before being renamed to St. Alexius, opened in 1869. So let's just pause there and think about a hospital that has been in community since 1869. Okay, so when we talk about closures of hospitals and we think about it as static, it is not. It is not. And so to me, that number is one that I really want us to really contend with as I start to show you a little bit of preliminary data about what this closure means. So the Alexian Brothers also built Alexian Court, providing senior housing on Chippewa Street, Sherbrooke Village, a nursing home, and had a PACE program for adult daycare. So this was not just a hospital, but a hospital that was part of a larger healthcare safety net within South City.
Dr. Mati,
Yes.
were we supposed to be looking at a different slide deck or the same one?
Different slide deck. It has
Okay, yeah, we're not seeing that
Have I stopped sharing?
Yep.
now.
Let me tell you something. Thank you, Dr. Corey Bradley, because the rest of you were giving me reactions, but I'm sure you were just as confused. So thank you. South City, see? Do we see it?
Yes, we see it
okay,
now, yep.
there. Okay, so let's bring it back. Alexian Brothers also built, like I said, senior housing, nursing homes, and adult daycare. But it's really the fact that this has been in existence for over 100 years that I think needs to sit with us. It faced a lot of financial challenges throughout its history. The ownership of the hospital has changed several times since 1993. Hospital's been through a series of financial struggles related to an unsustainable business model, unfortunately. There were competition with neighboring FQHCs, as well as financial impropriety from previous ownership. So the result of this combination ultimately and very unfortunately led to bankruptcy. So in 2021, the hospital was rebranded to South City Hospital after being bought by New Partnership during those proceedings. Lutheran School of Nursing, affiliated with and owned by St. Alexius, was forced to close in July of 2022. So it's clear that this is a healthcare pillar, right? It has a 190-bed hospital, history of caring for the city's most vulnerable, and I'll show you data that really makes it clear to me why this must be and is such a priority. Services provided were often demonstrated as founders' Catholic virtues, a small hospital that provide personalized care. I love that Craig included this personal detail. Psychiatric and mental health care are a big part, this most significant part of their outpatient services, which is again highly concerning to me, given the fact that most of the people that are impacted use it for either emergency services or behavioral health services, overwhelmingly so. But they had an exorcism there in 1949. Bariatric surgery, wound care, charity care to provide for the less fortunate, all part. So this went very fast. The mayor acted very quickly, and the first thing she did was work with funding partners to see if we could save the hospital, to see if anyone could buy it out. Unfortunately, the rapid time within which the closure was imminent did not make it feasible for the other healthcare systems to take it over in such a short time. I'm a seasoned leader, but a naive when it comes to these sort of things. I'll tell you that I'll have nightmares about the conversations that I was a part of during that week for some time. It is business. It does not reflect people. And it was really tough to sit in rooms and have the conversations that were had. So for me, it was important to bring the conversation, and I want to thank the mayor for giving me this platform. She didn't have to, and it was predominantly a business conversation, but I needed to talk about how this would impact employees, how this would impact access, right? And linkage to care moving forward, and the community at large, given some of the history I've given you. So this is the data that I've requested from South City Hospital. I have only gotten the data in green. The data in blue is some data that's received, and red is not yet received. We're giving them time. This has been sudden for all of them. I'm very thankful for the data we've received, but I believe this type of data in its fullness will help us with an access plan. I've already reached out to the CEOs and met with the president and CEOs of our largest hospital centers. We've had conversations with the CEOs of the FQHCs, and then we are bringing in the IHN, the Regional Health Commission, and BHN to really have a collaborative approach to the long-term issues. My first act, though, was to ask the city to hold up a job fair within a week of closure, which we did downtown last week. I want to thank the director of Slate and the director of personnel for leading those efforts. And we had over 20 different healthcare systems represented to provide options to folks. I'll be honest with you, it wasn't a great turnout, but it showed that we cared, and it provided anyone who does want to have access to employee opportunities with options moving forward. So a few data slides before I open this up for discussion. The patient, this graph from the little data we got talks to you about patient count percent by payer type. And the plurality of patients seen at SCH were uninsured, so that's 35%. When we look at by service type, you can see here that the majority of patients are seen in the emergency room, so that's 65%. And then outpatient accounts for 16%. And I'll tell you that psych services make up a predominant amount, and separate from that, acute psych services, as you can see, also make up a significant amount of the services. We looked at patient count by month, starting from January 1st of 2022 to May 31st. And the number of patients has been slowly increasing since that time, with a total count of over 8,000 patients who frequented that hospital in a year and a half. This is not insignificant. And when you think about the number, the percent I gave you here of 65% in the emergency room, we know from disparity studies that a lot of people who don't have their own primary caregiver use emergency services in lieu of having a primary care home. So the impact of this is devastating. My incredible team, and I want to shout out Matt Haslam, who literally put together all of the slides that you see here in half a day, one half of a day. That is the strength of my team. 2 epi people when I came, 11, and this is what they do for the community and for public health at large. So I just really want to acknowledge them. So this is a patient population by resident zip code. South City Hospital sees patients across the region and beyond, but as you can see, the majority live in the 3 zip codes nearest South City Hospital. That's the yellow star in the map, right? So the 3 biggest zip codes, they are represented being 63118, 63116, and 63111. We did the same for employees, and if it's a similar pattern, South City Hospital staff live in and around the St. Louis area. Most live near the hospital, more than half, 54%, living within our city, which is why this is something we must take on, and we must be intentional about, and many more just outside the city and South County. When we look at payer type by month, there's been a gradual upward slope of total patients. Percent of uninsured has been falling, percent of Medicaid has been increasing. Number of ER visits has remained consistent over time, and outpatient services increased by roughly 50% over the past year. So all these patients who started having initial visits in the outpatient setting suddenly have nowhere to go. And if any of you have tried to get linked to a doctor for the first time, you know the burden that it takes, the time that it takes to finally get in with someone, right? They keep you for an hour asking you your mama's history, your daddy's history, your grandparents' history, all that stuff. You're building trust, and then it's just taken out from underneath you, and you got to start that again. So my concluding thoughts here is that the impact of South City Hospital's closure on the healthcare safety net for the community is great. St. Louis City must grapple with the loss of another institutional anchor. The hospital's patient population will now need to seek care elsewhere, and we must coordinate a smooth transition for these patients to ensure their needs are met. Serena and I have really pushed this board. We've really pushed you, and you have met the challenge. You have been active. Every single one of you have reached out. You have used your resources in different ways. But if there was ever a time that I would ask the board to come together and to use your influence in your spheres, this is the time. This is the time for us to model why public health leadership is so important. Because if we allow this to be a 1-week, 2-week news cycle and move on with our lives, then we don't truly care about health equity. I'll stop now and I'll take questions.
Looks like Tim, you have your hand up.
Yeah, Dr. Mahdi, thanks for that passionate presentation. And first of all, I just actually want to thank you also for always calling out your staff. I think you do a great job of doing that. And
I
thanks
don't want
for-
y'all thinking I'm out here drafting PowerPoint slides, baby. I'm a pen and paper girl, you know, so my staff are immaculate and they never get credit and they don't ask for it. So I appreciate you saying that, but it's just true.
Yeah, you do a wonderful job of that. And I really appreciate you bringing our attention to this issue because it was brought to my attention. I saw it in the news as well. It's a tough problem because, there were, and I follow rural hospital closures because I do a lot of rural healthcare and there's been a lot of rural hospital closures. And I sort of put it in that context, but this is also clearly an underserved area, has financial issues, some management issues clearly. But I think you got your focus in the right place about where these patients are going to go. And so, my thoughts around that, I'm wondering if I'm thinking about this correctly, the, sort of emergency or the biggest issue right now, I would suspect that most of those emergency patients are going to go to two places. I would bet SLU Hospital and Barnes. Is that probably what you would guess?
Yeah, so my concern is, I presented this to the regional health commissions board and two excellent points came up. One is a CEO giving an even more impassioned plea because even family members of her who live in South City, the closure of another outpatient facility, Bridge, I believe it's called, with the basic within the last couple of months coupled with this is devastating and it's impacted even her own family members. But the second thing is people ask me about urgent cares. And while I appreciate the thoughtfulness, it's just not an answer. And again, this is a healthcare desert, so there's not as much density of those as you would think. There's only a few within a 5 to 10 mile radius. I think 3 is what we were able to map out. But and so while from a business perspective, Barnes and SLU can take these people easy. These numbers are light numbers for Barnes and SLU, but it's thinking about those social and structural determinants of health. Are those people really equipped to travel that distance and make those types of journeys? That's what's really concerning. So you have Affinia who's right next door. You have other health FQHCs, but they're always put in this position. Hey, can you save the day for thousands of patients? We don't have funding for you. We're not going to increase your resources, but somehow the FQHCs have to bridge the gap. So that's the mismatch that I think needs to be addressed. So I agree with you, Tim, from a business perspective, light numbers for Barnes and SLU. When I spoke to both their presidents and CEOs the week that this was happening, they were ready. They were ready to heed the call, right? But practically, we don't see this working out because I just think that the distance issue is an issue, or maybe it's not. And maybe that's where we focus some of our efforts, but happy to take advice.
It's really well taken because when we look at the rural hospital closures, the question often is like, what's the next closest hospital? And if it's 10 minutes away, maybe we don't worry so much. But if it's usually like an hour away. And then at people who don't have cars, who are, have disabilities or whatever. And, in a rural area, it's easy to think about that it's going to take you an hour across not very good roads to get there. But frankly, I always point out to people, it takes, more than an hour to get someplace in St. Louis.
It does. I've had people at clinics tell me that it took them 3 different modes of transportation to come get a COVID booster. They had to walk to a bus stop, take a bus to another bus, take that bus somewhere else and still walk a couple of blocks. Now think about that when there's snow or extreme temperature. It's not a simple solution.
Yeah, I agree with it. The transportation's a big issue. I agree with you. Urgent care, having gone down that path myself several times, and often what happens, I go to urgent care and then they say, oh, you got to go to the emergency room, and then I just wasted $75. And so that's ridiculous. The other thing is, the way I view it, and just correct me if I'm wrong, I view 2 buckets from what you said, and I've talked to other people about this too. There's the immediate emergency crisis, but there's the mental health crisis.
That's right.
And you really had some of those numbers the best you could in the presentation. And we already have a big behavioral health crisis in the city and in the county and all. And then to have the closure of this, where the heck are those people going to go? Even if we solve the transportation issues, we help people figure out where to go. That's not an easy solution. What do we do about the behavioral health problem? That's I'm not sure. We already can't deal with what we got, so.
Thanks, Tim. Other questions? So Dr. Mata, you mentioned that when you met with the hospital presidents, the biggest issue was timing wise, they couldn't act fast enough. Are there any conversations about what it would look like to reopen if when they have more time to really plan?
Not currently.
Okay,
From my, I don't have an MBA. It's a financial sinkhole for now. And so those conversations were valiantly addressed by the mayors and the mayor's office. Everyone that they could reach out to, funding sources were looked into, but it's just not a feasible route right now. I do anticipate with the normal ways that these things progress, that within, a year, maybe two, you'll start to see some movement there, but I wouldn't anticipate that anyone should expect that there's something salvageable here within the near future.
I had a question about the area codes 63118, 63116, and 63111. Like, what do you know? Like, what do we know demographically about them?
Yeah, I can bring you more information. That's an excellent question. What I can say very superficially at this time, Dr. Bradley, is that these represent some of the same zip codes that we see significant disparities across all of our indices. So now that we've increased our EPI team, we collect zip code level data for all of the metrics that we follow. And these would fall into some of the most disenfranchised zip codes across the board.
Okay. And then also, has there been any direct communication either from the mayor or from the Department of Health to folks in the affected area codes, or primarily?
It's really hard. And I guess unless I have missing something, my approach was to make sure we were clear in the press. The mayor put out a statement right away. So it covered the news cycles for a couple of days, but that's limited, right? I'll be honest with you, the majority of our response focused on the job fair, and we needed to act quickly because the state has the information for all employees. So we have like a listserv and a way to get to them. 8,000 patients in a year and a half with leadership that's currently dealing with a very sudden disclosure. I mean, we were talking up until the night before, and then Thursday morning, everyone was, everyone except for I think less than 20% of people to just help with the 2 weeks of rounding things out were laid off. So it's sudden, it's significant, Dr. Bradley, you know what I mean? So I don't know a better way to get to them. In an ideal world, I would love to be given patient level data that includes ways to contact people, but short of canvassing, and you all know my restraints with boots on the ground, like I've done a lot to recruit people, but I don't have the hugest team to do boots on the ground. So my thought process was bringing in IHN and RHC, who have been sort of that link between the healthcare systems and community. From an equity perspective, is a more long-term, thoughtful process about how to engage folks. And let's be clear, you and I, from the work you do, know that some of these folks don't even see this as devastating. Like, we're having these academic discussions and it doesn't even resonate with them. So a lot of this is even educating folks to the fact that this does impact them,
Yeah. And that's where I was kind of thinking, I didn't know if there was a way for us in appreciating feasibility, but in the world of like in limitless conditions of possibility, I would want for us as the board or something to like either show up or to have a communication and say, we know this happened, we're working on this for now. If something happens, here are the options, but that kind of thing.
I actually agree with you. I think the board has done statements before. I would really ask the board to consider it. I would ask for accountability. I think we should really talk with intention about some sort of report or feedback mechanism to make sure this doesn't die away. I get 10 fires a week. It's easy for me, even as a leader, to lose track of this. But if you all are constantly asking me each month, I think just that level of accountability goes a long way. And then I do believe that the healthcare systems are so enthusiastic about helping. So if we do need more boots on the ground on a consistent basis, I don't think we will have trouble amassing the kind of support we need.
So Emble, I see your hand up. I want to follow up on, I think, Dr. Bradley's question. If there is a specific message that we're trying to communicate immediately, we do have our partnership with the Office of Violence Prevention, who's doing an event in Marquette Park this Saturday. So if there's a way to have a presence there, And we also have our partnership with the Marquette Recreation Center,
Yes.
where we're seeing families come through there every Friday and Saturday. So that's another touch point in the month of August. So if there's some key messages that are ready and we want to be able to get those out, those two mechanisms are currently in place.
Can you just email me those after this so I make sure to talk to Kim about that with urgency today? Thank you, Serene.
All right, Nimble.
Hi, Dr. Marati. I just am thinking about, you had talked about long-term with IHN and thinking about what sort of resources we could also provide. So is there a way that we could propose these are the best locations and based on the population served, right? So we could map this out and say, can you help us build this? I'm already imagining what Tim is thinking and like, Inbal, you are so hopeful and ridiculous, but why don't we say, hey, long-term, this is what we want. We understand population is shifting and moving also, but this is what a good healthcare system would give to our people who are residents who are living here and not asking for that long distance travel. And when you change my healthcare system and resources, we need to know what it looks like and how we can translate that quickly.
So is the ask for some of the academic partners to dedicate time for folks to actually do that mapping out for us?
Yes.
Okay, I
Would
love that.
help
I
you?
hadn't thought of that, so I actually really love that.
Oh, okay.
Because, you know, in parallel, it does have to be short, medium term and long term,
Yeah.
Inbal.
Yeah.
And so the
Yeah.
long term has to start now. I couldn't agree with you more.
I mean, I want to go in and say you have to serve and serve the patients here, but you sat in that meeting. I can only imagine.
I've done more than I probably am allowed to already, so let me just back it up now, okay? But I think y'all know, okay?
You're muted.
Sam, yeah, I was calling on you too.
Okay, Dr. Madi, I heard you suggest that maybe we make a statement as a board. Is that what I heard? And, or at least I'm throwing that on the table. And
be thoughtful about where you send that. I think in the past, we've done something that we've just posted somewhere. But in thinking about foot traffic, I would just be thoughtful and allow the board to consider communications that are public in general, but also may be specific. Especially when I think about what, you know, Inbal just said, you know, who are the leaders that need to get a direct communication about this? So that folks haven't already moved on is just something I would throw out there.
yeah, and I was thinking through this and, you know, I don't know if we're ready to make a statement today, but one of the things I was wondering about is if we but you know, I don't know if time is of the essence, I'm sure it is. But if we created like a little subcommittee to meet and draft up a statement and then get some input from your excellent folks that the slides you already have and anything else you can pull up. And then we could draft something that with thinking about the audience that you just said and what the board would support. Would that make sense?
Yeah, I don't want to create more work. This board has already worked out, so I'll allow you and Serena to think about that. I will say that meetings are starting between BHN, IHN, so many letters, IHN, BHN, and RHC as early as this Friday. And you know, another way to maybe shortcut this is to ask that maybe a representative of the board is invited to those meetings to provide a voice to the board and provide feedback back as well. I will obviously be at those meetings, but there's a couple of ways. I sprung this on y'all, as you know, it's already happened, so not to be crass, but it's not as if I need a statement from y'all like tomorrow type thing. This is going to impact those communities for months to come, years to come, right? And if we don't do something, generations. And so there's time for a thoughtful response. I just wanted to provide you with timely feedback. A lot of times, because I didn't put it on the agenda, I have to wait a month and then it further puts things back. So I cut through that. And if you saw it was in my departmental updates, I just provided a little bit more context. So I didn't cheat.
I like that as a middle path. Possibly we could have somebody go to those meetings and report back to the board. I mean, we could even make a short statement today, or maybe we've already said it, that we back you up in your concern about the about this and the holes that it would create in the safety net, which already has them. And that, I've seen with rural hospital closures that sometimes they just wipe it out and it's a parking lot and it goes away entirely, but sometimes you really want it to be replaced by something to replace the services that are provided. If it's not still a hospital, it's a clinic of some sort, so.
Yeah, and I think I put this question in the chat, but I'm pretty sure Dr. Tepe is probably a member of IHN or RHC or one of them. So
Yeah, IHN in her capacity as a CMO.
that's what I thought. So we might have folks who are already at those tables. So then the request would just be to connect to them and ask that they're able to provide information to this group as a whole. And if there's any way that we can support what they're doing, that person who's already a part of those groups would be our point of contact instead of sending an additional person.
It's a good idea.
All right. Any other questions or discussion on this agenda item?
Thank you, everyone. Although it seems not much, I got 3 additional ideas just from this conversation I hadn't thought of, actually 4. So all of you who spoke up, please email me afterwards. I haven't had my coffee, but everything that was discussed here was enormously helpful, and I will go back to the meetings that we're continuing to have. So thanks, everyone.
Thank you. All right, our next agenda item is a committee update, and we'll start with academic partnerships.
That's me, I guess. We have not met since the last meeting, but I sent a note out to the group and we're going to meet in September. I think there's some movement on what we talked about last time. So we were really energized in the last meeting on MOUs, I think. And I think there's work proceeding on that. So I'm sure we'll have more to report at the next meeting about that. So we have a very good group with Craig and Dr. Ross and others.
Okay, thank you. Governance and nominating committee, Linda.
Hi, Serena. The Governance and Nominations Committee did not meet this past summer month, but our recruiting efforts continue in earnest. Dr. McBride had suggested we contact an assistant professor at the Brown School who was extremely interested, and so we are in conversations with her. Also, I've been in conversation with Professor Rob Gatter over at SLU Law School, as I think Craig and Dr. Mati may know him. I think he would be a fine addition to our board, specifically because he's done a great deal of work around COVID, public health restrictions, et cetera, et cetera. So hopefully we'll never need that expertise again, but one never knows. I will be, I just would like to, on behalf of the committee, I'd like to ask my fellow board members here, if you have additional nominations that you'd like us to consider. We are recruiting for 6 additional slots, including a new chair and vice chair of our board. So please feel free to reach out to me or to Dr. Colleen McNicholas or to Cyril Loom. So we are the 3 members of the committee, and you'll be getting emails and hearing more from us in the near future. So thank you.
Thanks, Linda. I don't know if this is a question for Dr. Mati or Kimberly. Are we still, or maybe Victoria, are we still getting applications through the website, through the mayor's office for folks who want to serve on boards? I know that there was a staff person that changed, and I don't know if they're still being monitored or.
Yes, they hired a replacement. I think he's been doing a lot of catch up, but I've already been getting, they actually sent me something to review for a mental health board, actually, candidate. So I know they're up and running. I will make the introduction via email to that person so that you can get whatever questions and see if we can start moving things forward. But yeah, he's been around for, I think, just under 2 months.
Okay, great.
Yeah.
Thank you. All right. Any announcements?
Serena, I just had a question. Something just showed up for me. Dr. Mate, when you were talking about the vaccinations, I was curious, is that something that we do that you say, yes, kind of a priority, we need to move on? And then the question related to that was, are we connected with the back to schoolish kinds of things going on? And are there ways that we already show up in those spaces to encourage families to pay attention to health related stuff and including
Yeah,
that?
so we have nurses. As you know, it's incredibly hard to hire, but even more to hire nurses. The pay deficit is much wider. So I really think Department of Personnel has been trying to help me bridge that gap. But we have at least 2, maybe 3 dedicated nurses who work within the public school systems. So that's one area that we constantly have a good back and forth. We help them with their policies. So throughout COVID, I would meet monthly with the school leadership. We continue to have those meetings, and my bureau chief, Suzanne Alexander, continues to meet with them as well. So that's another touch point. And then, as you may or may not be aware, there are back to school fairs that happen, the Urban League having the largest one. So we always have presence at those and show up as well. And then lastly, I just think they've been doing a fantastic job. We've consistently had immunization clinics every week to 2 weeks. To really make sure that we can get to as many folks and support them before the congressional dollars dry up and people start having to pay out of pocket for COVID-19. But for the regular childhood immunization ones, we have a contract with Affinia Healthcare. So I've been on radio twice this week, and we've been using other media to make sure that parents are aware where they can go. The county, as you know, is a great partner of mine. We play well together and we're very good friends. So they have a great program through their vested clinic as well. And we make sure to just support each other in publicizing all of those. But if there's gaps in what we're doing, please let me know.
You still have your faith community group board, or you haven't started that one?
That's been tough.
Okay.
We can talk offline, but it's been tough to get meetings back up. I've been pushing, but not pushing too hard. But that is something the 2 boards that I feel very passionately about is the Clergy Advisory Board and making sure they'd re-ups. I think they felt a sense of urgency. And to be fair, that was born out of the incredible leadership of Dr. Eccles. And I think a lot of them were very much close to that movement. So we need to really see and reestablish and make sure they understand that we value their input past COVID. But also if there's new spiritual leadership that also wants to be involved. And when I speak and I meet them, there's a lot of other people. So I think there's a sense of that we could bring them back and in post-COVID times. The second thing is for migrant and immigrant health. I think there's a great need to stand up an advisory board there. And I've been talking about it since I came, but unfortunately I have like 50 different priorities. So I need to be held accountable, but we have a lot of great leaders that we meet with already, collaborate with already. I think it would be great to formalize an advisory board, and through both of those mediums, I think we could do a lot more. So thank you for that.
Dr. Mate, is the Clergy Advisory Board still staffed? I thought we were providing staff support. Do you still have staff support from MHB?
Yeah, through Lisa, yes. So the staff support was not the issue. It was more scheduling issues and then.
Got it. I just wanted to make sure that piece was still there. So when you do stand it back up,
Yeah.
still have support.
So when I said I would talk offline, I think the easiest thing is for me to reach out to Lisa again and see the best way to re-engage folks and make some new invitations as well.
Got it. All right, Tim.
I'm glad that Corey brought up the vaccination issue, because when that report came by, I think we all ended up focusing in on the South City thing, but there's other issues, and I don't think we're going to solve the anti-vax problem easily. It's going to be a long-term fight to get back that issue, but we might want to keep thinking about strategies in that regard. I know your constant passion around that helps, but if there's anything else we can do. My question also is going to be about COVID, believe it or not. I'm reading, in all the reading, I see that there's a new variant of COVID. It's rising various places. You're the expert, so I get a chance to ask an expert. what's going on with that. It'll be in your report, but should we be concerned about that in the region? I'm sure we should be concerned, but could you just give a sentence or two about that?
You cut out at the end there, Tim. Can you,
I was wondering about COVID, the new variant of COVID and what it looks like in our region.
yeah, we're getting a lot of questions about that and a lot of misinformation. So first of all, I want to make people aware there's a forward. I've actually got a prepared text in my phone that I copy and paste to text, because I've probably gotten 10 very reasonable people who are like, this came through my family chat. So to be clear, there's a variant of concern globally that is not a variant of concern in the US yet, but the current variant of concern, the XBB.1, has been around since April. It has just been increasing in dominance over time. It's highly transmissible, but we haven't seen it impact severity. So it's not like people are flooded in the hospitals, and it's not as if mortality rates are up. I'll be honest with you that my ability to give you up-to-date information is going to be limited because that lags. We are only getting monthly data from the CDC now. We no longer get data from the state, and my team has to rely more heavily on sewer shed data, which is also lagged significantly behind, right? So I'll tell you that it's clear to me that there's an uptick that shouldn't surprise you. I've been educating you guys for years now that there's a couple of times in the year where you're going to see COVID cases up, right? Back to school, holidays, always, right? And then winter more than summer and times when people are outdoors. So we've always had an August spike. And so have been part of our campaign with school nurses as well. But like I said, our COVID clinics have been going weekly to bi-weekly. We've had gift cards that we're helping to support people to get there, and trying to really diversify information, because we know people have COVID fatigues, about it as well. People are not trying to get boosters. I'll tell you that. We get very limited numbers. So we decrease the batches that we do and increase our touch points has been our approach.
That's really helpful. Thank you. I understand what you're saying. So that's great.
And I think it's interesting that you mentioned the group text, because I got one of those too. And I know that there was this I Heard project that's being coordinated out of Washington.
Yes, they are phenomenal. They are so good, and they're very supportive of both health departments. But child, I have not seen this level of misinformation. It came from some high people, so I had one response, and then I got like 4 more that day, and I was like, oh, I'm gonna put that in my notes just to copy and paste. And so I actually will touch base with you, Kim, afterwards to talk to Ivorian, who is our incredible new social media lead, and has been, if you've seen, the quality of our social media has increased significantly over the past couple of months. And Kim has just done an incredible job in her new role as supervisor onboarding folks, and Ivorian has been one of them. But I do think it needs to be addressed, because if I, as the director of health, am getting it from my circle of friends, I can imagine. And it's interesting because I think that people really believe the light switch approach. They really thought COVID was over. So people are just shocked. Well, so-and-so got COVID. I was like, yep, they'll continue to, you know what I mean? It's like, you shouldn't be shocked when people get RSV or gastro or, the flu. It's just the cadence will change, right? So I think it's also important to re-educate people about the fact that COVID will never go away, ever. It's not gone. And you shouldn't be shocked that people get it. So yeah.
Okay. Any other announcements, questions, or updates?
I think, just among us, I've been watching RuPaul's Drag Race, so I want to say Among Us Squirrels, because that's how it's girls, Among Us Girls. Among Us Squirrels on this here board, I really do think that the South City closing is also about, right, this health equity emphasis, and I've been a part of the project with the Department of Health. And what we're going to do, we'll talk about this.
He's been leading this effort for almost a year. So let's just clarify.
I didn't want you to say that, because then people be like, well, what he been doing?
Oh, a lot. We can bring those slides too. So we got those receipts. Okay.
But we're going to come to, one of the ideas is to really center the health equity with the Board of Health, and we become incredible advocates throughout the city, disseminating both the messages, the communication, and the efforts. And so I wonder if there's a way for us to capitalize on this moment to really raise the specter around health equity. And I think that's a potential angle, while we're also making sure that actual needs get taken care of as well. So I just wanted to kind of affirm us moving in that direction.
Okay, thank you.
With great timing with the new community engagement committee. And I think they will be a really critical part. This may be probably the priority action point for them once they're up and running.
Yeah, Craig has a comment in the chat, moves it from theoretical to real people. Yeah. All right. Our next meeting will be September 21st. This meeting is adjourned. Thanks, everyone.
Thanks, everybody.